Mizrachi, and I am interested in this position because I've been a healthcare leader for a large healthcare system for 23 years, and a lot of your requirements um, coincide with things that I've done in my career, the successes I've had, and the teams that I've led and built. I'm interested because this is also a remote part-time position, which fits my schedule exactly and is a unique opportunity in my view. What am I good at professionally? So I've led and mentored teams doing large-scale operation support projects for a for-profit health system that owned about, at one time, as many as almost 200 hospitals, and now is at about 75 hospitals. I've been involved at all levels of management, senior management at corporate, senior management at facilities. I've dealt with the department heads and even the staff, online staff, in terms of training, leading, and mentoring teams. As in fact, I was chosen by my direct report, who was president and chief medical officer of the company, Community Health Systems, to mentor my peers, VPs and SVPs, on how to scale and implement their projects. And so we had a goal of about $14 million in combined cost savings and revenue enhancements, and we overachieved that goal within 1 year. And I worked with about 7 or 8 other VPs that year. I've also led large-scale clinical IT and projects associated with physician practices. I put together a business case and got $30 million in funding to put a clinical system in 20 new emergency departments that we had purchased from a system in Texas. I worked with the vendor. I was the project manager and project executive, and successfully managed that program, which had a material impact on earnings, patient volumes, and most of all, improving patient care through the patient tracking system. I've also led a created a new project for consolidation of physician practices with a mind to giving patients a better experience in being able to meet with all of their providers in one building, and also saving on lease cost and duplicative staffing costs. I'm very good at making presentations, public speaking. I've done training at all levels, and I've reported from everybody from the chairman down to the department heads, as I mentioned. I have fundamental skills in analytics, but I do work well with financial and clinical and data analysts, and know how to create benchmark reports to help measure and drive performance and improve the quality of care. I also like to work in teams. I can work independently without a lot of leadership, but I enjoy being on a large team and leading large teams. My ideal work environment is one where I have a good working relationship with my direct report, which could be the founder in this case. I don't need a lot of management. I do like to meet one-on-one routinely just for updates, going both ways, not only from my end on what's going on, but with the founder, and work very collaboratively and am an excellent communicator. I'd like my career to evolve into a position just like this. I've had a long career in healthcare. I was a regional vice president for a large physician management group that managed hospital-based positions for systems across the country. I ran the St. Louis regional office with about $30 million in P&L responsibility, and Also organizational responsibility for the regional recruitment, scheduling, credentialing, and billing services that we were associated with. This seems like an excellent opportunity for someone like me. Um, I am excellent at running efficient meetings. Um, translate, I've done, I have consulted on a strategic planning process with my university in central Missouri and led the faculty, staff, senior leaders, and students in a strategic planning for their current strategic plan, so I'm very good at that. I'm good at establishing business goals and building accountability through collaboration and teamwork without a lot of oversight. I've done that on very large teams. Um, I really am okay with working within whatever constraints a company has. I'm very flexible and can leverage the resources that the company provides, and oversee onboarding. I've created and built a lot of teams, many of which are still at the company and are performing at a very high level. I'm a very clear, direct communicator and can be a coach when I need to be and can hold people accountable when I need to. So with all that being said, I hope that I'll get a chance to speak to you directly about this opportunity, and we'll talk to you soon.